and you'll probably see something pop up for you. Well, I want to welcome everybody. My name is Nancy Chernett. I am a member of Climate Action Lower Merion, which is a relatively new, I guess we're about a year and a half old, organization that is very much committed to Lower Merion, and Nancy Winkler is going to be talking about that. But first, I want to just welcome you and glad that you're here tonight. And both Nancy and Stacy just want to tell you a little bit about their organizations, and then we'll get started with the program.
Okay, great, thanks, welcome. Nancy, I'm Nancy, and then Stacy, you can see in my screen anyway, she's next to me, she just waved. I guess Stacy actually started working with us forming Climate Action Lower Merion at the beginning, and then she's sort of been engaged with a lot of the great work Climate Action, NARBs, and NEARBs have. So she's actually a NEARB, and I think our two organizations have very similar, some of the goals are very, very similar, which are, to empower and educate and engage mostly the citizens and our elected officials, hopefully, to understand what's going on and to think about how we can, as individuals, make a difference at this time. I think we thought it was important to go very local because we didn't really see that conversation happening very much within the township in an organized way at the level that we think a community of our education and affluence and demographics would be expected to be doing. And as we thought about it, we thought the best route would be to think about what we as individuals can do, and partly through some conversations with Nancy Chernett and her husband, Dan, kind of framed the work around not just being an individual person trying to reduce their trash or ride their bicycles more, which is important and all good, but also to try to be influencers, because if we can be influencers, we're having a much bigger impact than if we just live our life in a more sustainable manner. And so it's that engaging with people where you're still pretty close to who they are, where you get to know them and you can engage with them in lots of different ways is sort of, I think, the biggest, if I would say that's the big overall concept of what we wanted to do. We built out a website and are editing it to update it. And that's it. There's an advocacy group. I'm personally not engaging with the advocacy side, but there is an advocacy group involved there. I'm doing more of the educational and website, trying to keep it better updated. But Stacy, you want to say anything?
Yeah, I would just add that there's definitely a large community of people who think this is important and are committed to making sustainable changes. And I think one of our biggest goals is to just make that voice be loud and constant. And people have all kinds of demands on their time and their life, but I think most people in our community agree this is important. So part of the effort is to just keep the conversation going, and so that and meet people where they are, so that it's like this is a long-term thing. So we need to get it in people's thoughts, and then as they go about living their lives over the years, they start to make their decisions include and make them more sustainably. And that's Narberth, it's Lower Merion, it's everywhere. But I agree with Nancy that to build this sense of a local community where you live in a place that really cares about all of these things, and you can see it by the choices we make in our homes, what we expect of our local government, how we participate, and to become more like I guess, activists, maybe, you know, just to take on to take more action to making it happen. So.
And I'll put a plug in that if you are interested in getting involved in either group or both groups, you are welcome and wanted. So put your name in the chat and please give us some contact information.
And thank you for coming.
And thank you so much for coming. Thank you. Well, I want to start by introducing our speaker, Dr. Richard Tolin. He is a Lower Merion resident and a climate activist who will be talking about a wide variety of health impacts of climate change, including air pollution and some other things we can do to mitigate our own risks, which is really important. He will also discuss what's different about health impacts we face in Lower Merion. I'm very interested to hear that. Dr. Tolin is a retired gastroenterologist who practiced at mainline health hospitals, and serves as the chair of the Department of Medicine at Paoli Hospital. In 2017, he trained to become a member of the Climate Reality Leadership Corps, started by Al Gore, with the intent to educate other physicians about the health impacts of climate change and environmental degradation. Since then, he's given many presentations on a variety of aspects of the climate crisis to both physicians and lay audiences. So welcome, Dr. Tolin. Dr. Rich will probably talk for around a half hour, maybe a little less. We're going to hold questions till he's done because we've really given a lot of time at the end for people to ask questions and for open discussions. So if you want, you can put your questions in the chat and I will monitor those. Or when we enter the question period, you can raise your electronic hand. Does everybody know how to do that? Just to review, you'll see down at the bottom of your screen, reactions. If you click on that, there are several different icons, emojis, but there's a raise hand at the bottom, and that's what you want to raise. So, Richard, are you ready?
Yeah, thank you for the introduction. Let me turn on the share screen. I think you're seeing it now. Are you seeing my first screen? You all seeing it?
No.
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 Huh. All right. Let me.
Did you open it on the screen?
I opened it. Oh, here it says share.
There you go.
Now let me.
Yeah.
Now do you see it?
Yes.
Yes.
Okay. All right. Let me. Okay. So. I chose to begin this presentation with a photograph of the coronavirus. And the reason is that although the coronavirus pandemic itself was not caused by climate change, it demonstrates a type of risk that every species of plant and animal on Earth faces as a consequence of climate change. One of the prevailing theories of how the pandemic got started was that the virus, which had been stable in a bat population, jumped to a new species, humans, when the bats and humans came in contact with one another in the wet markets of Wuhan. That's a possible, probable explanation. Habitats all over the world, which have been stable for thousands of years, of plants, animals, predators, food supplies, are now being altered by climate change. Species that are highly temperature dependent are migrating poleward. Others are migrating due to changes in humidity and rainfall. Other species can't migrate because cities, rivers, mountains, highways prevent them from doing so. And so habitats are being altered with plants, animals, bacteria, and viruses finding new homes. And species are becoming vulnerable to disease because of these environmental stresses. And so this is one way that climate change is putting the health of everyone at risk. So how does climate change affect health? Climate change affects the pathogens that we encounter, but also the air we breathe, the water we drink, the food we eat, the weather we experience, and therefore it should be no surprise that climate change poses a risk to health in every parameter that we can imagine. We can't possibly cover all of these in the time we have allotted, so what I'm going to do over the next 20-25 minutes or so is I'm going to focus down with a brief introduction to the impacts on infectious disease, heat illness, and air quality, and then at the end, I'll conclude with an explanation of why our risks in Lower Merion may differ from those of other neighborhoods. So I've already discussed a little bit about infectious disease, but this slide uses the Zika virus and the mosquito that carries it as an example of how climate change alters the lifespan and behavior of a typical pathogen and the vector that carries it. This mosquito that carries the Zika virus has been migrating poleward and has already been found as far north as southeastern Pennsylvania. So the range extends because of the warming, more friendly environment. And then there are more days when mosquitoes are active and able to reproduce. The mosquito's reproduction rate increases, so more generations are born each year. And the mosquito's metabolism accelerates, causing them to bite more often. But that's the vector. The pathogen, the virus, that incubates in the mosquito much more quickly and increasing the time available for transmission. So whereas in a cooler climate, the mosquito might live out its life expectancy and die before the virus has multiplied in sufficient quantities for the mosquito bites to become infectious. But now, in a warmer climate, there's more virus developing more rapidly, and so the mosquitoes are becoming more dangerous. I could have shown a similar slide to this for describing the West Nile virus and its vector, mosquitoes and birds, and Lyme disease pathogen and its vectors. Both have become much more common in southeastern Pennsylvania in recent years. In fact, Lyme disease was probably the first recognized worldwide pandemic of climate change. And Lyme disease has Pennsylvania as its epicenter. Now, we can protect ourselves from mosquitoes by making sure there's no standing water on our property. Most mosquitoes are homeboys, they don't travel far. So if you're bitten by a mosquito in your backyard, the chances are that mosquito was born and bred either on your property or maybe next door. We can protect ourselves from tick-borne diseases like Lyme disease by spraying with permethrin our shoes and clothes that we wear during high-risk activities, such as gardening, hiking in the woods, golfing, or importantly, children's play in the grass. The permethrin is not toxic, doesn't stain, and will survive through about a dozen washings. So the clothes should be sprayed, especially for kids, because when kids get Lyme disease, it's oftentimes very difficult to diagnose and misdiagnose. Another example of a pathogen expanding its range is Vibrio, which is a bacteria which, when ingested, causes gastroenteritis. And I'm not going to go over the details of these two slides, but let me just tell you that what they show is the Vibrio concentration in the waters of the Chesapeake are increasing because of climate change and the warming waters. But not only is the Vibrio increasing in the waters, it's also increasing in the oysters in those waters, and the oysters that we eat. So let's talk a little bit about heat. So in Philadelphia, currently it's rare to have 100-degree temperatures recorded in Philadelphia. But by mid-century, we expect to have 10 to 15 of those days per year. If we define an excessive heat event day, let me get rid of this. If we define an excessive heat event day as a day in which the heat itself results in a statistically measurable increase in mortality, we can see that in Philadelphia in the 20th century, there were about 6 of those days per year. In the coming decade, we're going to see about 46 of those days per year. And left unchecked, we're going to see almost twice that by the end of the century. Heat-related illness occurs when the thermoregulatory system is impaired or overwhelmed due to high ambient temperatures and high humidity. And also by low air velocity, high physical activity, and cardiovascular strain, dehydration, and low sodium. So heat illness itself really comes in two forms: heat exhaustion and heat stroke. The more severe is the heat stroke. And the way we separate heat exhaustion, which can be treated by drinking water and cooling down, from heat stroke, which is a life-threatening emergency, the primary thing is confusion, loss of consciousness. If we start seeing influence on brain activity, then we can assume that there's a high likelihood that multiple organ systems are going to, or about, or at risk of failing. And so this is a medical emergency. If someone has, suspect heat stroke, you need to call 911 and get them to a hospital with intravenous fluids. Whereas someone who's still has good mental activity, they can just be given water to drink and cool down. Now, who's vulnerable to heat-related illness? Well, people with chronic diseases, people with cardiopulmonary disease, diabetes mellitus, and renal disease, they have less leeway and less room for error. If they're stressed, they're not as resilient. People with impaired judgment are at more risk, or impaired mobility that they can't get to cooling. Medications can increase the risk. A lot of blood pressure medications, diuretics, laxatives, they can cause increase the risk of dehydration. And if you're dehydrated, you can't sweat as effectively and can't cool down as effectively. NSAIDs, things like Aleve, Advil, ibuprofen, those kinds of drugs can impair renal function and impair renal resiliency. People who are older have diminished thermoregulatory responses. By that, I mean, when it gets hot, people's blood vessels on the skin should dilate, and that enables the warm blood from the core to get to the skin where it can be cooled down with sweating. And those kinds of physiologic responses can become less efficient as people get older, and also as they have chronic disease. Occupation is an important one. Every year we hear of a high school football player in practice in August, preseason practice, dying on the football field. So heavy physical exertion on a hot day can be a risk. Let's move on now a little bit to air pollution. So air pollution accounts for about 20 to 25% of all deaths due to heart disease, stroke, lung disease. About 20% of deaths due to diabetes mellitus are thought to be due to air pollution. And let me just say, and I didn't mention this before with the heat, but the heat-related deaths are dramatically underreported, because people who die from heart disease or renal disease that were under added stress because of heat, their death certificates oftentimes don't say heat death, they say whatever the underlying chronic disease was. But most of us can intuitively understand that air pollution can cause heart and lung disease. But what's not as well recognized is that, and even by physicians as well as lay audiences, is that air pollution harms are much more widespread and involve many different organ systems. And I've listed here some evidence of air pollution causing brain dysfunction. There are some studies done recently of middle-aged men in Los Angeles demonstrating that exposure to higher levels of air pollution, whether it be the particulate matter, the PM 2.5, whether it be ozone, that a variety of forms of cognitive functioning are impaired by exposure to air pollution. There are now studies showing that productivity is impaired. There was a study in London which suggested that a 1 microgram per M3 reduction in PM 2.5. Now, the 1 microgram per M3 reduction, that's a very small reduction. The current standard from the EPA is that for short-term exposure, it should be about 35 micrograms per ml, per cubic meter. And we often see fluctuations of 10, 15 micrograms. But a mere 1 microgram in this study in London suggested that there would be 125 avoided traffic accidents with injury in the course of a year. There were studies done in China showing call center efficiency diminished when ambient air pollution was worse. Pear packers, that's sort of light manual labor or assembly line kind of work, very different from call center work and very different from traffic accidents, but it also is impaired with reduced productivity due to air pollution. But here's an interesting one that some of you might appreciate, the Major League Baseball plate umpires. For those of you baseball fans of you who watch baseball on television, you know that when the pitch is thrown, the TV shows the square of where the plate is, the home plate is, and where the baseball goes. And you know exactly whether the called pitch was a strike or a ball. Well, plate umpires have been shown now with air pollution in the area of the stadium diminishes the efficiency and accuracy of the plate umpires. And as little as 10 micrograms in over 12-hour exposure to PM 2.5 causes a 6% increase in incorrect calls, but a mere 1 part per million increase in 3-hour carbon monoxide because of heavy traffic outside the stadium results in an 11% increase in incorrect calls. So all these acute functions that are impaired by air pollution, we don't really know the cause. It could be a direct effect on brain function, or it could be that the air pollution causes distractions such as, coughing or wheezing or tickle in the throat or some other, distraction that makes these people work less efficiently. However, there are now accumulating evidence that chronic exposure does impact brain function and brain activity. When fossil fuels are burned, a lot of the concern about air pollution has been these particles that are 2.5 micron in size. They're small enough to get down deeply into the lungs. But there are ultrafine particles, much, much, much smaller, that are so small, so fine, that when they're inhaled, they can translocate directly from across the nasal sinuses into the blood vessels in the nose and in the nasal sinuses. And once in those blood vessels, they distribute widely throughout the body. And there are now autopsy studies showing these particles deposited in the brains of people with Alzheimer's disease and Parkinson's disease in proportions and in a characteristic that suggests that these particles play a role in the pathogenesis of both of these diseases. We don't know the extent of impact that it has, but we do think now that it's highly likely that air pollution has at least some impact on the risk of developing Alzheimer's disease and Parkinson's disease. And then even more concern is the 9/11 first responders at the World Trade Center. 20 years later, their average age now of those first responders is in their 50s, and 14%, a huge number, have cognitive impairment, again, believed to be due to impact on the brain of the air pollution that they were exposed to in the weeks after the World Trade Center collapsed. So those are the brief introductions to some of the direct consequences on our health. But now what I want to do is, oh, wait a minute, I didn't finish. I want to talk a little bit more about air pollution, the indoor air pollution. So The indoor air pollution, what I want to concentrate on is talking about direct sources of indoor air pollution: cooking, tobacco, fireplace. Well, tobacco we all know about, but cooking, burning methane or natural gas in the kitchen. So when you burn natural gas in the kitchen, one of the byproducts is nitrous oxide. And nitrous oxide in the air is very hazardous, especially to children. Children are most at risk because they breathe more rapidly. Their lungs are larger compared to their body size than adults, and their lungs are still developing. So there are no indoor standards for nitrous oxide, but the outdoor standard for the EPA is 100 parts per billion for 1 hour or 53 parts per billion long-term outdoors. Indoors, in a typical sized kitchen, baking with or cooking with a gas appliance can get indoor levels 3 times what the EPA says is dangerous for 1 hour exposure outdoors. And the result of this is that children living in homes with gas stoves have a 21% increase in lifetime risk of asthma and a 42% increased risk of wheezing with symptom severity correlated with the nitrous oxide exposures. There's now evidence relating these nitrous oxide exposures to ADHD in toddlers and diabetes and cardiovascular disease in adults. We don't know the mechanism exactly, but we have the evidence now that this is an important factor. Now, before you panic with your gas stoves in your kitchens, now what do I do about eating tonight or tomorrow? Just be aware that with good ventilation can dramatically reduce some of this risk. If you are stuck with a gas stove, as many of you I'm sure are, if you have a good working hood with a vent that vents outdoors and not into a crawl space with good ventilation, then that dramatically reduces this risk. So what other things can you do to manage your own personal risks? Well, you can get personal air quality monitors and purifiers. I have a picture here of a UHO brand. I have no interest in UHO brands, but it just shows you the size of with the iPhone next to it, which gives you the recordings of what the pollutants are in your home. You can electrify your appliances. If you are ready to redo your kitchen, get rid of the gas stove. Proper ventilation is important. Keep the air filters in your home clean. And the best way to reduce exposure to other toxins is to reduce the PM 2.5. That's the main pollutant that we want to look at when we see what we're being exposed to. And then outdoors, limit exercise when the air is polluted. Exercising is good for your heart and lungs. But on the other hand, when you exercise, you breathe more deeply and breathe more frequently. And if you're breathing bad quality air, that eliminates the advantage to your heart and lungs of doing the exercise. So exercise in a park, not along a busy thoroughfare. Electrify outdoor equipment, get rid of the gas-powered lawnmowers. I certainly don't want you to walk behind a gas-powered lawnmower on a hot summer day when the ozone levels are high, and especially if you have some mild or not so mild heart and lung disease. If rush hour is unavoidable, close your windows and recirculate the air. And children should avoid diesel school buses and avoid kitchen nitrous oxide unless you have really good ventilation of your stoves. Okay, so what's different about Lower Merion? So if we look around the country, we see the same housing patterns in every metropolitan area. African Americans living in crowded inner city neighborhoods with lots of cement, little grass, few trees, few amenities, and poor health, surrounded by whites living in suburban neighborhoods with lots of grass, trees, amenities, and good health. There were a myriad of New Deal and mid-20th century policies to support home ownership on a whites-only basis, intentionally. This is a map drawn by the Homeowners Loan Corporation in 1937. The Homeowners Loan Corporation was created as one of the New Deal programs to provide federal mortgage guarantees to prevent foreclosures. There was a handbook written and passed out to local realtors with written instructions as to how realtors should define the kinds of neighborhoods that were worthy of federal investments. They were told to color categorize the neighborhoods. A red neighborhood was defined as being flat terrain, odors, paved, manufacturing, and inhabited by immigrants and Negroes. And you can see in Philadelphia, North Philly, red, inhabited by Negroes. West Philly, inhabited by, and I use Negroes because that's what they were referred to in 1937 in these maps. And South Philly, inhabited at the time by Jewish and Italian immigrants. Now, the green areas, they were the best: wooded, shaded, golf courses, rolling hills, white residents, and they were the neighborhoods that were worthy of federal investment. And if you look right here in this map, that's City Line Avenue right here, if you can see my cursor. And what do we have here? Green, Lower Merion. Lower Merion was where federal government was willing to invest money in housing, not in North Philly, West Philly, or South Philly. So African Americans were forced to rent in continuously deteriorating neighborhoods by a myriad of other policies, including, but not limited to, overtly racist zoning, highway and transportation policy, exploitation by slumlords, realtors, lenders, and state-supported white supremacist violence against African Americans trying to escape those living conditions. So let's look at these areas today. This is a map done in the last few years, and I'm sorry it's so small, but the red dots here show where public housing, mostly for African Americans, has been placed. And you can see almost all of them in North Philly and in West Philly, a few in South Philly, none in Lower Merion. Toxic brownfields and industrial sites, that's also red. You can see they're almost all in the African American areas in North Philly. We now look at heat islands. So a heat island occurs when, if you have a neighborhood with a lot of trees and shade and grass, there's shade underneath the trees, but there's also cooling adjacent to the trees and adjacent to that area. Areas that have very few trees, lots of cement, retain the heat and get much hotter in the summertime. And so we call those heat islands. Now, if you look at this map, and again, I'm sorry if it's too small to really read it, but the dark red is the bad heat islands. And these heat islands have, in the summertime, temperatures that are between 4 and 8 degrees higher than the average temperature for the Philadelphia area during that same time. Now, if it's 4 to 8 degrees higher than the average, it's going to be 10 to 12 degrees hotter than the cooler areas, which is where we are in Lower Merion, where there's a lot of trees. So the difference in temperature between neighborhoods in North Philly and neighborhoods in Lower Merion in the summertime could be 10 to 12 degrees Fahrenheit. If you look at the concern about global warming and climate change, the concern is to keep centigrade temperatures less than 1.5 degrees, rise less than 1.5 degrees, or maybe 3 or 4 degrees Fahrenheit. So we're seeing local impact. The local hazard of the heat islands far exceeds the heat hazard of climate change. And then if we go one step further and we look at the air pollution issues, this is a map of childhood asthma. The red is the most hospitalizations for childhood asthma, darker colors less. And you can see in Philadelphia, The highest incidence of childhood asthma is in North Philly, the same areas that were redlined, that have the public housing, that have the higher, that have the heat zones, the heat islands. And so African Americans are 3 times more likely to die from air pollution, twice as likely to have childhood asthma, 10 times more likely to die from asthma, because they breathe 38% more PM 2.5 air pollution, are exposed to 63% more air pollution than they produce. And this is almost all a direct cause of housing discrimination in the 20th century. So how are we different in Lower Merion? We're pretty lucky in Lower Merion because all the hazards were pushed over to less powerful neighborhoods. So the formerly redlined areas have hotter heat waves, higher prevalence of respiratory disease, more diabetes, obesity. We've already gone through a lot of that. So how does climate affect health? There are a myriad of ways, and that's the formal part of my presentation. I'm now happy to take any questions or engage in any conversation and give or take with any of you.
Do you want to close your screen? Do you want to close your screen?
Yeah. How do I stop share?
Yep.
There. Okay, I did it. All right. Okay.
So the first question I see is from Sean McMurphy. Sorry, I just messed up your name. She'd like to know more information about gas blowers. So leaf blowers is, I think, what she has is referring to.
Yeah.
Sean, is that correct?
So my understanding is that leaf blowers, I don't really understand the mechanism of how they work, but they apparently put out far more pollution and PM 2.5 pollution than most other lawn equipment, even lawnmowers. And the people who use these leaf blowers are breathing the air right around them. And there was a guy using a leaf blower near my house recently, and I went up to him and I told him that when he uses leaf blower, he might as well smoke a pack of cigarettes. And I told him that the mask, the KN95 mask that we use to protect ourselves from COVID, can also filter out some of the PM 2.5 air pollution. And that if he really has to use this leaf blower as part of his work, he should be wearing one of these masks. Now, I saw him a week later and he wasn't wearing it. So, but yeah, the leaf blowers are bad news. My understanding is that they also disrupt the life that lives in the grass, the grasshoppers and other kinds of things. I don't know too much about that, except that they're destructive, but they are terrible for the environment and they're very polluting, and they shouldn't be used.
Other
I
questions?
think didn't they outlaw? I think they outlawed them in California. They're so bad. And I saw the number of miles you have to drive in a car in order to produce the same amount of pollution as using a leaf blower was something like 1,000 miles. That was ridiculous.
They've done
So that's
a lot
why
of
they
good
outlawed it.
things. There are a lot of good things in some of the jurisdictions. There are some jurisdictions in California that have banned introduction of gas pipelines into new construction homes. And they did a calculation as the amount of money for healthcare that would be avoided by eliminating gas in the homes, and because of asthma in children and other things, and the number was enormous. I don't remember what the number was, but clearly, if we care about the cost of healthcare, eliminating fossil fuels would do us a lot more good than trying to come up with a better insurance policy or insurance plan.
Stacy has a question about to share any landscape companies that you know of that offer alternatives to leaf blowing.
It was more a comment too for the general group. If anyone
Yes.
knows of companies, because I think a lot of people outsource their landscaping. And
There is
Yeah, okay,
in
great.
lower, and I think I forget the name of the company, but there is a company, I think it's based in Haverford, or maybe it's Havertown. I forget the name of it, but I remember seeing a leaflet that they were looking for work, and they only use green equipment, electric equipment. I don't remember the name of the company. I can try and track it down and pass it on.
Thank you.
But there is such a company, and it's either in or near Lower Merion.
Well, one of the things that's interesting to hear about that is that one of the things that we've been hearing, and I think this is something that you encounter whenever you're talking about changing the way you do things to go to a new way of doing things, the resistance starts with, well, it's too expensive. It's we can't actually do the job that we need to do because the whatever the equipment is, whether it's electric cars or leaf blowers or whatever, lawnmowers aren't at a standard that we need to do our job. We'll lose money, and that's interesting to hear that there may be actually companies that see this as a business positive and are, so I think it would be terrific to learn more and find more of these companies. Maybe we can all try to share all that with each other. That would be great.
Yeah.
Yeah. It's interesting also because the people who are using them, I mean, maybe are at risk, and they may or may not know that, but the owners of the company may not care about that, but the people who are using the equipment may.
Can I ask a question in a different direction?
Sure.
One of the things that we're, I think, wanting to do is to encourage people to walk more and encourage people to cycle more. And of course, there's the risk of being a pedestrian or a cyclist in Lower Merion and many parts of Lower Merion, of being hit by a car. But in addition, the idea that maybe breathing the air, is the air in Lower Merion that much cleaner that we don't need to worry about the exercising issues? Not that we shouldn't worry about them, but is that a dumb question, I guess?
Well, it's not, it's a good question, but it's hard to answer because air pollution, it's like radiation. There is no safe level of air pollution. Less is always better. And what we find is that the improvement, the reduction in risk is actually when you improve the air quality, when improving air quality of relatively clean air, you get a much bigger bang for your buck in terms of the health benefit than if you clean up dirty air and make dirty air half as dirty, then that helps you a little bit. But if you make relatively clean air half as dirty, that gives you much more benefit. The curve is steeper at the lower levels.
Oh, that's very interesting.
Yeah, so it's always, less is always better. So where do you draw the line? How much risk are you willing to take to exercise? What I can tell you, the studies where I mentioned that exercise wipes out the benefit, I mean, exercise in a bad area wipes out the benefit, were done in London. They had people who would go on a 2-hour walk in Hyde Park, where the air was relatively clean, and go on a 2-hour walk in downtown London, where the air was relatively dirty. And then they measured heart and lung function before and after each of those walks. And they found that a walk in Hyde Park, at the end of the walk, the heart and lung function was improved in people who had heart and lung disease and also people who didn't have heart and lung disease. But no one got improvement in heart and lung function when they walked in the dirty air. So if you have an option to be in a cleaner place, be in a cleaner place. If you're going to be riding beside 95 or along the Schuylkill Expressway, keep away from it. But a city street, there's no right answer, because just less is better, and you want to do some bicycling. So, I mean, I think the air is, what I would do is go by the monitors, look at the air quality index on your phone and the weather app. And it's not very accurate because they don't have very many, enough monitors. But if you look at the monitor and if it says the air quality is good and okay for exercise, it's not perfect. It's still probably not great for exercise, but it's probably good enough. But then when you look at the air quality on your phone app, take into account where you are and assume that if you're in a park, your air quality is going to probably be a little bit better than what it says the air quality is in Lower Merion on average. And if you're along Lancaster Avenue, it's probably going to be a little bit worse than what it says in Lower Merion on the weather app.
There's a question from Arnold. Any opinion on, it's an odd question, on Lower Merion School District's intention to cut down 500 trees for playing?
Well,
We can spend the rest of the night talking.
it's a shame thinking that people think that way are teaching our kids. I don't know what else to say. I mean, we all know that that's a terrible idea.
Well, it was,
knows that. The difference between, part of the difference between Lower Merion, as I showed those maps, between Lower Merion and the heat islands and the poor health and the asthma in Philadelphia and North Philly, is the trees, the absence of trees. And the trees just don't benefit the person standing under the tree. Trees benefit the neighborhood. So yeah, it's a bad idea.
and the trees actually absorb PM 2.5.
Yep.
Yes. We have quantified data from several faculty at Villanova. I've been speaking with them more lately in terms of, and I don't have those numbers in my head, but how profoundly carbon wise, and that's not even getting to the water and all the other things and water pollution, that the removal of the trees will have, which they now mitigate all air pollution, but in particular the Blue Route, which is near the new middle school, places a big burden that is offset by those trees, in addition to millions of other reasons. But it has been quantified and continues.
It's 8,000 tons annually by cutting down 500 trees.
Yeah.
I actually found, I found that the professor who did the calculation at Villanova.
Dr. Langley.
Yeah, I'm a volunteer at Stoneleigh, and I saw this guy there, and he was taking some notes, and I said to him, "Well, what are you doing here?" He said, "Oh, I'm bringing a class here tomorrow." So I said, "How about calculating how much CO2 production would be increased or not be eliminated by cutting down 500 trees?" So he made that into a class project, and that's how we wound up with that number.
Who is that speaking?
Arnold Iser?
Yes.
Wow, that's interesting background. Huh. Can I ask again, maybe a different question, but one of the things that I think, and this is about, and Stacy said this at the beginning, but that trying to talk to people about their health and how global warming affects their health. I think a lot of people in Lower Merion don't think they're impacted directly today by global warming in their health. I guess it's a two-part question. One is specifically around Lyme disease, because I know so many people who have had devastating outcomes with Lyme disease. I mean, just devastating, including one person whose child died. How can we, I guess the bigger question is, how can we sort of concentrate this, drill this down, and and make this message more clear and relevant to our community?
Well, I guess just,
Because now, I mean, I think your talk is amazing, but I just don't know how many people will watch this talk, or do we need to figure out how to do it over and over?
Yeah,
or-
here's the problem that I see. When I give these talks like this, I'm preaching to the choir. I mean, I'm sure everybody here already knows that their health is impaired by climate change, and they want to do something about it. The better audience, and what is frustrating me no end, is that I can't get Mainline Health to sponsor a talk like this. Mainline Health would attract an audience of people who have heart disease, for example, and then to explain to them that their heart disease is made worse by air pollution, and that maybe their heart disease would be better if we had electric vehicles in front of their homes and electric vehicle charging stations in their apartment building, and maybe that would improve their health. To get an audience of people who care about health, not necessarily about people who care about climate change, these people haven't yet made the connection. And these are the people who are concerned about health. And that to me is the target audience.
Why do you think that happens? Do you have any explanation for why that's like that? It's puzzling to me.
Why Mainline Health won't do it?
Well, I guess it's true of all health, I imagine.
Well, no, it's not true of every medical center. In fact, Yale and a few other medical centers have very, impressive teaching programs on climate and health.
But it has to do with the politics, I'm sure. That's where my implication. Yale's as a so-called liberal. They even have a whole climate program. I get emails from them every week about the climate, but they're considered, radical liberal. I think the fossil fuel industries have something to do with that too.
Yeah.
It's becoming, well, I don't want to speak for Dr. Tolin, but I know from what I studied at Columbia recently, it's actually becoming more in the medical curriculum, looking at particularly the environmental inequities resulting in the health inequities. And even you'll see that in sort of mainstream medical
Right, but Lower Merion is overrun with deer. I just want to go back to the deer tick thing, and Lyme. Lower Merion is overrun with deer. I mean, I have a friend whose son died, and living out here got Lyme disease, got tick-borne illnesses, multiple tick-borne illnesses, and this young man suffered for years and then died. And I don't think people here connect. I mean, anyway, I'll stop. I think if and I guess, and it's not that I don't care about racial justice. I care deeply about racial justice. It's a very, very important to me. I'm just trying to think about how to connect with the people who live in Lower Merion and who are thinking about this issue. That's all.
Well,
we're not thinking about it, and how do we get them to think about it?
right.
I mean, can I make a suggestion? Write a letter to Jack Lynch, the CEO of Mainline Health, and tell him, and I don't want it to come from me because he's heard from me so many times and we've had so many conversations. But if he gets a letter from Climate Action Lower Merion, from a group that says that you are interested in teaching about health and about climate change, and you know that there's a big impact of climate, of climate on health, and can Mainline Health help provide some expertise to assist you in your teaching programs?
Good idea.
Great idea.
Also, I think, and it's a very sensitive thing to approach, but the people who are the most open to hearing it are people who, as you say, are affected. And I only know that in working with people with poor pregnancy outcomes who we're not aware, but you can show them literature and kind of communicate that to them. And while it's devastating, it's what everyone needs to learn. And at least if it starts to get out there, unfortunately, through the people who are affected, it will go further than that as
Yeah.
they share it.
What you said is fascinating, because when I first started trying to get Mainline Health to get into this area, we got my base is at Paoli, and I know all the people there and the lawyers there, and we got, and the docs there, and we got Paoli to write a proposal that Mainline Health endorse all these things, for climate change and do this teaching. And the result was that they said, great idea, and they put it in their pocket, and we'll get back to you. And this went on for about a year with just delays. And then one of the vice president for medical, the chief medical, the highest ranking physician on the staff, I forget his title, got West Nile virus. Pretty sick with it for a while. And West Nile virus is a climate change disease. And after he recovered, he's the one who became the champion in administration to get things going. And he started to create a sustainability committee. And he and I met a few times to talk over about a teaching program to teach the physicians. And then, unfortunately, he died of something entirely different. And then there was no one in administration at a high level willing to take this up. They had the pandemic and they had all these other things in their plate. Just nobody wanted to be bothered by it. And what I've been able to accomplish and what we've done is actually they've included some of this in the teaching program for the residents at Lankenau. So we've given them lectures on air pollution and other kinds of things. So they're willing to, involve the teaching programs, but not to bring it out into the community. They do a lot of good things. They have a garden, a vegetable garden, which they provide vegetables for people who live in West Philly who don't have grocery stores in their zip codes. They do a lot of things, but they won't do it publicly, and they won't get an education. They won't sponsor an educational program.
That's
It's
really
not
what makes
it's not a revenue generator. Why would they do that?
But they do
They
so
do a
many
lot of
other
things.
educational programs.
First of all, they're required by law to do it. They have their tax deduction requires them to do a community needs assessment and publish it every 2 years, and then they have to figure out what the community needs and then what they can do without pay to assess those, to address those needs. So they do things like find out how many people smoke, and then they have the smoker cessation clinics. They find out how many diabetics there are, and they have diabetes education programs. But they don't do anything to find out how many people are breathing lousy air, and how do we tell them to protect themselves from breathing lousy air?
Because they don't see any profit in it. If they give a diabetes lecture, they figure they're going to get some revenue out of it too downstream.
Yeah, well,
Can I ask a general question? How does Philadelphia compare in terms of pollution to other major cities, and the disparities in our city? Are they different than other cities? Do you know? I've never read that. I think it's high in Philadelphia, right?
I did see that. I remember seeing graphs about that a while ago, and Philadelphia was relatively poor air quality compared to most other cities. I don't remember the exact numbers or the exact place. My vague recollection is maybe it was like 8th or 10th place, but in terms of bad air. But I don't quote me on that.
It's pretty bad, but it's not the worst. Yeah, I just want to raise one other point, and also mention another resource called Air Now. It's a collaboration between the EPA and local environmental, state environmental, or so it's called Air Now, and it gives you a detailed outbreak of air pollution. And it's more detailed than what you get on your weather channel.
Right. And there's an app. You can get an Air Now app.
It's a free app you can get called Air Now. So,
zip code.
So what I want to point out is what happened when the fires were so bad this summer in California is that after about 10 days, the air got here and raised the the PM 2.5 up above 200, close to 300, which would put it in the neighborhood of where Delhi is now. So it had nothing to do with there were no fires here, but all that air pollution came across the country. So yes, it doesn't matter where you are, you're never safe from it.
Well,
And
can I just add to that? We're in the path of the jet stream. And that also affects asthma rates and obviously, sort of rates of pollution that kind of push through our area as well.
I'd like to just report on one other thing along this line. My brother took a trailer across the country and he ended up in Banff and he went all over the West Coast. He said when he was up in Banff, he couldn't enjoy it. You couldn't sightsee anything because for miles and miles in every direction, there is smoke. And he said he woke up at night. He and his wife both woke up at night. They don't have asthma and they were feeling short of breath. And he said that's been like that for 3 or 4 summers. You can't see it. That's in a very famous, beautiful area. Yeah. I mean, people don't realize what's going on really when you come right down to it. They don't really. They don't realize what's going on.
I mean, I think if you do travel, especially if you go to places that have glaciers and things like that, it's just so evident how bad things are. But Ava, I wanted to go back and hear a little bit more about that comment you made, if you would, about the jet stream and how that contributes. How does that?
I don't know if Dr. Tolin knows more about this, but I know. So I'm a health psychologist by training, and one of the professors in my graduate program, and this is about a decade ago, but he studies asthma rates in the U.S., particularly in certain populations like the Latinx population and things like that. And the jet stream kind of ends in the South Bronx. I don't know where it kind of starts below us, but I do know that Philadelphia is directly within its path. The jet stream is right what we talk about, how airplanes kind of fly, and the lag time that it takes when you're flying back from the east to the west. And so it pushes a lot of pollutants, particularly through industrial Ohio and Pennsylvania towards us. And so we get a lot of we in this area particularly tend to get a lot of polluted air kind of flowing through. And that affects asthma rates and I think other probably lung diseases as well.
That's an interesting comment, because as we've talked about the need, why do we care about getting Pennsylvania to push its electric utilities to draw much more heavily on clean energy? We have our clean energy standards in Pennsylvania are, if not the worst, among the absolute worst in the country. I think a lot of people think, well, why do we need to bother to do that? Because we're a fossil fuel generator, et cetera. So do you know if it picks up the emissions coming from the fossil fuel activities in Pennsylvania?
I don't know enough about it. I will tell you, I moved from north of New York City in Westchester County in New York City, in a town called Eastchester, about 6 years ago, with my 2 kids and my husband when I was doing pretty decently with my asthma. My older son also is an asthma sufferer, and we both noticed a severe increase in asthma, bronchitis, all kinds of issues, medical issues.
And you live here on the main line somewhere?
Yeah, we live here on the main line. So yeah. Yeah, and it's I've
But
noticed
but
direct
that, did that
effects.
happen during that? There were several days here where they said it's not really cloudy out. That's the smoke from out the west. I don't know if you
Right.
heard.
Yeah. I remember
Did that,
looking out one day and the sun was just completely blocked last
yeah,
year
and
by,
it wasn't because of the weather here. It was because of the fires. Did
right.
that affect you during that period of time? Was that?
I don't know if I noticed a direct effect during that time. Usually for me, it's sort of personally, like I'll catch a cold. And not so much actually during COVID, because we've all been wearing masks. But if I catch a cold, um, I notice that I tend to develop bronchitis much more quickly and easily, after having that cold. And same thing with my older son. We have a nebulizer at home, if you know what that is, and we end up needing to use that very regularly for him if he catches a cold, and he's a school age child, so an elementary school age child. So, it's something, again, I noticed that directly affects our family.
Aviva, while you're speaking, you asked a question in the chat a while ago, and would you ask it again? Changing subjects somewhat.
Yeah, well, it's also, I mean, I think it's sort of related to, and it's certainly related to the talk. I think there are a lot of, like you said, lower SES, socioeconomic status families in the Philadelphia area. And, I guess you were talking about racial disparities. I know I'm very well aware of racial disparities in my work and how they affect people medically. And I guess I was just wondering, that's one thing where I know personally, as someone who is white and does not identify as a person of color, I have concern for, and I, feel sometimes helpless and kind of supporting people to change that. And I wonder how we can all in Lower Merion, which is a predominantly pretty white place, try and support, health issues in the entire Philadelphia region, and particularly in our region, for people of color and people low SES, people who are immigrants.
Well, I think the most important thing we can do to help mitigate the harms of, at least the health harms of racism, is to stop using fossil fuels. The biggest harm is air pollution, and a lot of the air pollution is from automobiles and gas-powered automobiles. And if we direct our activities toward improving air quality by reducing the use of fossil fuels, that will help mitigate the a lot of the health harms of racism.
Yeah, and as your map showed, the industrial, where industry is, which is emitting CO2 and other chemicals, is where North Philadelphia, particularly, and West Philadelphia, and certainly in South Philadelphia. Interesting, I can't remember the name. The refinery that had a fire by the airport?
Yeah.
The group that really got that shut down is and primarily African-American environmental group in Philadelphia. Is it Power? I can't remember the name of the group that did it, but they are very, very aware in Philadelphia of what's going on, and they're really at it. Power is another organization. I don't know if it was them, but that they have a very strong interest in climate justice. And truthfully, a lot of, at least originally, what was proposed in Build Back Better addressed climate justice. And there's still things that in there that are addressing the environmental issues. But it's so endemic and pervasive. It's very hard.
Nancy, what did you say the name of that organization was?
Power.
Okay.
Yeah.
I wanted to also ask Richard, as you were looking for audiences here in Lower Merion to speak to, did you reach out to the Lower Merion Township has a task force, a health advisory task force? Did you?
No, I don't know anything
Did you
about
reach out to them?
No, I don't know. I didn't know such a group existed.
Yeah, in fact, one of my neighbors here around the corner is on it. And I think she's the chair.
The other way possibly to get some audience in, the hospitals, academics, is to talk with the public health programs at Drexel, at Jefferson in particular, because there is an interest there. And, there's always the, medicine versus not medicine, but it is a way of getting there to be education for the entire institution through the population health and public health programs.
Well, I know Villanova has had outreach and community education, and so is St. Joe's, and a lot of the universities do. But again, when they attract a lay audience on a climate-related subject, they attract audiences of people who are interested in climate. A hospital will attract people who aren't interested in climate, who haven't made the connection. That's really my point of view.
Yeah, I think that's a really valuable insight.
That's why
I agree.
I'd like you to send a letter to Jack Lynch.
Jack Lynch. Okay. Okay.
Don't quote me.
No way. Yeah, I think, with academic medicine, with academic institutions, there's always a hospital associated with it. So it could, it could be an in. I mean, Jefferson has so many hospitals now. It's amazing how they've grown, my former employer. But I mean, if you can't get in through administration in the hospital or in medical school.
I mean, I don't know that I see Jefferson so much out here on the main line as I see Mainline Health and Penn Medicine.
That's true. Well, they used to be affiliated, but I mean, just in general, it's a competitive market, and if one's doing it, the other wants to do it too. So you're right, but Mainline for sure, from our perspective, is the way to is the institution to address. So yeah, let's come and write to Jack Lynch and say, hey, you're not doing your part.
Yeah, can you help us out with trying to educate our community?
Yeah.
That's our mission. Can you help us?
Yeah. And our focus is very educational. So yeah.
Yeah.
My former boss is on the board at Mainline. I can also ask him.
Who was that?
My former boss.
Oh.
David Nash.
Former boss? Who?
David Nash. David Nash. Everybody knows David.
Yeah.
He was the dean of the School of Population Health, which is where I work. But I can ask him in terms of how to push this button, because he knows.
Yeah. But
Those are important audiences.
What I don't want is to have Jack Lynch think that I'm going around him, because that would end my relationship with him. So if you do that, don't say it was my idea.
I won't.
Because he's Jack Lynch's boss, and he says, hey, I'm heard that you won't sponsor talks, and I don't want to,
Oh, there's an interesting comment here, Deb Robbins. Deb, I believe you, Deb, you're a medical professional. I believe you're a teacher. Are you a professor of nursing?
I was a nurse practitioner in maternal fetal medicine. So
okay, she's interested in doing a program on the impact of climate change effects related to fertility, pregnancy, fetal, neonatal effects of climate change for parents. And I think, like, if you want to get pregnant and you want to have a healthy outcome, and you want your, that's a topic that's pretty near and dear to a lot of people.
Yeah.
Well, I was actually responding to Lou's query about talking to parents, but I mean, it applies.
Well, I would ask that as we do this, we are trying to brand Climate Action Lower Merion and Climate Action NARBS and NEARBS. So we would want, as an educational group, so we would want to be part of whatever, how that got put together. And Lou is making a comment here. Did you want to say anything, Lou?
Oh, so I think this would be a great thing to have a similar type of event with sponsored by the ISC. The ISC does this parent ed series every year. I don't know what their schedule is for the remainder of the year, but if I could get something like this on their schedule, I think that would be great. And my wife happens to be the chief of obstetrics at Bryn Mawr. So if you're looking to do something in a hospital setting, she may also be able to open some doors.
I think the other important audience, I don't know, is young people, the schools. I think, our generation has really dropped the ball, even notwithstanding the efforts of this group. And I think our largest hope is with the younger generation.
Yeah, I think we've really struggled as a group to connect with the younger generation, probably because we're old and we're not cool and they're not interested in, working with us.
Both the high schools have environmental clubs.
Oh, yes, but we've worked we've spent quite a bit of time with the Lower Merion High School Environmental Club and have a connection to the advisor there. And we did a Zoom with them. We've got a couple of them. I wouldn't assume that an environmental club is necessarily where the interest lies. Sometimes our experience with the Lower Merion High group was that they seemed to be wanting to do projects that they could kind of flesh out their resume. I don't know how else to say it. It was pretty like, what can I do that I can put on my college application? And it was stuff that was pretty easily teed up, and activism was not what they were looking to do.
Yeah, that's discouraging.
I'm sorry to be so blunt about it. We did work with them. We did a couple of interesting things. We did a tree planting, and we did a trainings program for them on the Regional Greenhouse Gas Initiative, and got a whole bunch of them to write letters and train some of their other students. So that was good, but it just didn't then grow to something more.
And on the other hand, with that though, we worked with some students with CAN this summer too, and I agree there's a different skill set when you're a student versus when you've been a professional, and so they do need a lot done for them. But if we were to spend some time making it easier for them to take some actions on health, then maybe we would get some interest if we kind of pre-thought. If we rely on them and say, oh, could you work on this, we probably won't get a good result. But if we spend some time making it easy for them, all you really need to do is do these things that we're laying out for you, we might get a good result.
Right, that's what we did with the two, that was exactly what worked. That was what worked.
Yeah.
And then I think the pandemic just made it that much harder.
Yeah.
And health may not be the entree for young people. They think they're invincible, but they are concerned about the environment. I think a lot of them are. So the angle isn't the health angle. It's more natural resources in our community and elsewhere.
And some of
Does anybody on this call have a skill set in doing that kind of work? Because we know, as a Can and Colm have talked a lot about our great interest in engaging with the younger people in the community, and we need help. We know that we want to grow that part of the work we do, and we need help. So if anybody has thoughts, or people who might want to sit down with us and brainstorm and come up with something, please let us know.
So,
We,
Nancy, just because one of the things I was thinking of is, I mean, because climate is such a health issue, as we all already knew, but we found out more tonight. Has there been any interfacing between the EAC and the Health Advisory Council or the Health Advisory Board or whatever they're called?
No, I really am not in a position right now to talk. I'm here as a member of COM. I'm not
Okay.
really here to talk about anything, on that, around that.
But
That's
I
a good
would like to.
suggestion. That's a good suggestion.
I would like to see that, because that I come at this from a transportation issue, and that I push more sustainable transportation. But that's transportation is also a safety and health issue itself, even if you take the environmental piece out of that. So I think there's just so much crossover between the environment and health that those two groups need to work together. And I understand that you're here in a different role, but that we should try and push those two groups to work together.
Well, I see somebody just turned on their video camera who might be able to speak a little bit more from a leadership role on this topic. Gilda Kramer, are you interested in weighing?
Gilda, I just want to say I'm amazed you're here and still awake after that
And
marathon
thank
session
you.
last night.
Yeah, really.
Yeah, thank you, Gilda, for your interest in being here.
It's been tough to stay focused tonight, but I've been listening in. So I always